Hello everyone and welcome to my radiology channel on YouTube. Today's video is going to show you once again why it is so important to take a CBCT scan prior to placing a dental implant. Looking at this 3D rendering of a CBCT volumetric scan, we see that tooth number 14 is missing. And as far as I know, the patient understands that this side was entirely extracted and ready for dental implant. And I think one of the areas that we want to evaluate by taking cone beam CT scan is the position of the maxillary sinus. We don't exactly know the shape and morphology of the sinus floor. Sometimes the sinus floor may have a partial septation, which we want to be mindful of, especially if you're planning on doing a sinus lift procedure. So why don't I go through this volume in all three different planes and let me know if you see something very interesting at this site. So let's go through the axial view first. Starting from the top, scrolling inferiorly through the volume, and now we are into the mandibular arch, and let me go back up. Now let's go through the coronal sections, starting from the anterior, moving posteriorly, and let me just go back to the side of missing number 14. Did you guys catch that? Something unusual? Now let's go through the sagittal views. I hope you all saw it by now. If you didn't, I'm going to put my crosshair right to the side of the interest. Okay, so what is this radial opacity? There's an amorphous radial opacity at the side of number 14. Now let me remove the crosshair. Upon careful examination, we can see that there's a thin radiolucent rim all the way around this opaque entity. And you can see that as well here. And it's also visualized in the axial view. So what is that? Look at the shape and the location of this entity, as well as the radial density of this radial opacity. Does the density of this opacity look very similar to dentin of the adjacent teeth? Yes, absolutely, that's correct. So now I've practically given you what this is. So this is a retained root tip. That is absolutely correct. If you saw that and guessed it from the beginning of the video, that's wonderful. So this is a retained root tip that neither the doctor or the patient knew of at the time of before the time of taking this scan. So obviously this is gonna play a major role when you're treatment planning implant, right? So this needs to be either extracted prior to planning on placing an implant, or at the time of placing an implant at least. You probably don't want to just place an implant right through that retained root tip. Additionally, the ridge height measures roughly 5 to 6 millimeter depending on which section I measure. So that's relatively short. So that again is going to change the treatment plan for the patient and the doctor. So I hope you can take away from this video why it is so important to take a cone beam CT to evaluate through the site of interest in all three different planes. Another thing is you are responsible for visualizing or evaluating rest of the scan. You can have sinus pathology, you can have pathologies in the pterygopalatine fossa, right here. Oh, let me get out of that measurement tool. You can see pterygoid plates. You can see greater palatine canal and lesser palatine canal, as well as the turbinates. So there are a lot of structures that are captured here, including portion of the mandible and rami. So yes, I have to read all of that. There I have seen cases of having developing malignancy along the palate. I have seen cases of squamous cell carcinoma in the maxillary sinus. So yes, you absolutely want to visualize entire scan. That is the part of the reason why I like to scroll from one end of the scan to the other end of the scan when I'm demonstrating the case in the videos. Anyway, I hope you find this to be helpful, and take care, and I'll see you in the next video.